My first job out of the military as a healthcare administrator was at the University of Iowa, working for Dr. Brown. And he became my mentor in healthcare and a very dear friend as well. And so we watched from a distance as he went through his own experience with an advanced illness.
My story goes back almost 30 years. When I was in the Air Force, practicing medicine in San Antonio, Texas, I likely acquired hepatitis C from one of my patients. When I was 62 years of age, went 6 months into a chemotherapy regimen for hepatitis C, but I ended up with multi-organ failure. And I spent almost a month, delusional and unconscious, in that ICU with my family at my side. Those decisions about withdrawing care became very personal. Miraculously, I woke up. While I was learning to walk, regaining strength, I had plenty time to think, boy, if this happened to my family. I mean, I was a leader in organized medicine nationally, so I knew if our family struggled, every family in the country facing complex illness is struggling to make those decisions.
And as I corresponded with him and talked to him following that episode, he expressed to me the learnings that he had had and how he felt that he was kept on this earth with a mission to provide assistance to families as they go through advanced illness, especially in relation to understanding what their values are, what their goals are, and really the questions to ask as they went through these periods.
Curadux telehealth platform, coupled with the very experienced physician care guides within Curadux, allow these members and their families to navigate the system, assuring that ill member's values and goals are driving the decision making.
For many years I worked in cancer care, and by virtue of that I felt that I was always very empathetic with the cancer patient. And then I became a cancer patient. My husband and I have been married 43 years, and I could tell it was devastating for him. I've only seen my husband cry a handful of times. I had an opportunity to be introduced to Dr. Brown through Steve Long, and we talked about Curadux. And this is a group of individuals, physicians, who they themselves have been through a life-threatening crisis and now understand how they can provide essentially navigation through the healthcare system. He and I had a session, if you will, where we talked about where I was. Dr. Brown affirmed for me that the steps that we were taking were the right steps, that we had gone through the process correctly. That was very reassuring because you trust your doctors very much, but what Dr. Brown brought to the equation was a sense of neutrality. He never said, you should be doing this. What he did was share his knowledge with me to help me make informed decisions. What I'd like people to know about Curadux is that it's twofold. It helps you make decisions, but it also lets you know that you have an advocate in your corner.
So my mother-in-law was diagnosed with cancer about 3 years ago. And our systems are built to do things. And so the oncologist did things to the very end. And he would say, hey, there's something we can try. And what she would hear is, I'm gonna be cured. We received a call on a Monday afternoon. Within 2 days, my mother-in-law was gone. And it was not until a few hours before she passed that my father-in-law really understood that she was going to die. And I thought to myself, this is exactly why Curadux is so important. Had they really understood what their values were, had they really understood what their goals were, had they really had a physician care guide to have them ask the questions that would have elucidated this whole journey that they were on, they would have been so much better prepared. And that's the kind of thing that I think we can help our associates wend their way through, and they can have a different outcome than we had. So this is really managed through our Human Resources Department, and they have the ability to give that associate access to the website.
That member would first go to the Curadux platform, enter the code that the benefit department has given them, and they'd complete their personal health story. They'd have as much time as they need to do that. There's a template on the platform that allows them to assure that the questions that help the care guide understand their values and goals, along with their medical background, is already so that when they schedule a physician care guide consultation that lasts almost an hour, the care guide would have that information available. They'd meet each other virtually on the telehealth platform.
Louisa Hangay has been one of the folks that we've had here that was an early adopter of this in her own health journey. And there are folks like her that are ready to answer questions from a personal perspective and say, yeah, here's how valuable this can be and here's why you ought to think about it. Certainly there is no requirement. We don't require anybody to do this.
The one thing I want people to know is we allow patients' values and goals to frame their decision making. As a patient, I can tell you, all I really cared about when somebody was interacting with me, did they value me as a unique human being? I often say, I've always had a physician brain, but now I have a patient heart.
It's all genuine. It's all true. It is there to help you.